You're going to dip your fingers in the oil just a little bit, not too much oil, okay? Here you go. So what you'll want to do is, as you're massaging, you want your fingers to slip, but you don't want too much oil dripping all over. So you'll have to experiment a little bit and get a feel for how much oil you'll use. So if you look at my hands, that's kind of how I keep my hands, so they're not too wet with oil and not dry. And what you want to do is you want to make sure you can feel your baby's spine. So go ahead and feel right in the middle and feel the little bones there. And that's the spine right in the middle. And that middle is pretty tender. If you press right on the middle, on the spine, it'll hurt. So we want to stay along the sides of the spine, and that's where our muscles are, our back muscles. So if you're, let's say, working really hard and you hurt your back or stretch your back muscles, that's usually the muscles that are hurting. Yeah, what you can do also, what you can do, Chantil, is why don't you hold her and put her on your lap and hold her like that. See how she's comfortable, okay? You can also hold her on your shoulder if she doesn't like her tummy. So you could try different positions so that you can access her back. So some babies like it if you're kind of like when you're burping, so you have her sitting on your lap like that. That works really good too, okay? So you'll have to learn what your baby likes. What you'll want to do is massage both sides around the spine, and with that you can use your thumbs gently. Put your hands around the body and gently use your thumbs in a circular motion and go down the back. So you can use your thumbs like that. The other way to do it is, which I typically like to do, is I use this little, just a little bony, the fleshy part of your thumb, okay? The pad of your thumb like this. So what I do is I keep my hand on one side, with the other hand I gently massage. Now here what I'm doing is I'm pressing down and just moving out, okay? Pressing down and moving out. So what you're doing is you're gently stretching the muscles sideways a little bit, but you're not putting your hand starting in the middle of the backbone, but along the sides of the backbone, and that's where the muscles are. And you see how your baby responds, see if they like it, and once you start doing some of the areas of the body, you'll see your babies might like one or the other. Usually the favorites are the feet, and the back are usually the favorites, okay? Take your time, do both sides for a couple minutes, and your baby's not going to tolerate like a half-hour massage or anything. Once you get good at it,
Marley does.
Marley does? That's awesome. Yeah. Once you get used to it and comfortable with it, it's going to be probably 10 minutes at the most, and then they'll be a little uneasy and be like, "Oh my God, what's going on? Let's move on." So see how they do. But go ahead and take your time and do the back a little bit. So what I'm going to do is I'm going to show a lot of the techniques here on Rosalind, and then I'm going to wash my hands and kind of go around and check the other babies too, okay? All right. So you want to think about covering every single little inch of the muscles besides the spine, besides the backbone. She likes that. Look at that. Yeah. Yeah, she likes that. There you go. Oh, I know. Marley's doing better this time, Joe.
Yeah, she likes it.
Yeah.
She's getting spoiled with it.
That's okay. Yeah, it's a good idea.
In a little bit, I will.
That's actually a good point. When to do the massage also. If you do it right after eating, it's a little harder, because imagine if you just had a good meal and your stomach is full and somebody's going to give you a back massage, and you're on your tummy. That's not going to fly. So,
She eats,
oh,
might help her go to sleep.
yeah.
And I think so. It does help her.
Yeah. So sometimes,
Not like a belly.
if your baby is more of a spit-up baby, that might be a problem. And then in a couple more minutes, I'll show you, we're going to turn your babies over, and I'm going to show you the legs, arms, and also the stomach. There is a massage for the stomach too that helps with digestion and with everything.
With time, she does pretty good, especially with
Yeah.
therapies and stuff.
is she's had 3 abdominal.
Yeah,
It's the scar tissue.
Yeah.
I think she over time has gotten a lot, better with it.
hmm
But I do think at times it's, it bothers her.
yeah. With the scar tissue, some of the oils or some of the lotions aloe vera with vitamin E helps.
Yeah, we do a lot of vitamin
So
E,
that's good.
which is- Where you go?
So that could be part of the massage also, because you're massaging that in that area. You could make that a part of your massage also if you'd like to do that. After you feel you've done the back muscles well along the sides, then what you'll want to do is turn your baby over and then work on the legs. So take off socks if they're wearing socks.
Socks? What are those?
Yeah, absolutely. And then you might need to put more oil on your hands. And with the legs, what I do is I start off at the thighs and I work down. So what you'll want to do is use one hand and your thumbs, and the thigh muscles are basically in the front of the thigh and behind the thigh. Okay, they're all around too, but the front and the bottom ones are primarily what you're going to concentrate on. And you can use your thumb to gently, in a circular motion, go from top to down, just very gentle, top to down. Like that. Yep, she likes sides too. We can do sides along the side and then along the bottom. See what you feel comfortable with. The thumb feels good, and also if you just hold the leg and just gently squeeze down with your hands, that's okay too. Basically what we're looking at doing is squeezing the muscles and letting it relax and squeezing the muscles. A lot of the lactic acid and other just byproducts move, and the blood moves, and it just feels great. So just gently squeezing and relaxing is what your baby's looking for.
I like it.
Yep. Thighs, and then
So you're going to get mommy in there?
when you do the thighs, after the thighs, you want to concentrate on the calf muscle on the bottom, on the lower leg on the bottom. So with that, I typically just use my forefinger and my thumb. And you don't want to squeeze hard, because you can easily squeeze hard and it'll be uncomfortable. Just gently down like this. Here you go. Oh my goodness, look at her. Yeah. Yeah. With the feet, you want to use your thumb again for the feet, and what you'll want to do is hold the leg like this and just gently pinch the feet between your fingers and in a circular motion again. You're going from the front of the foot all the way to the heel. Right on the heel, it's going to be a little tender, so don't press too much on the heel, but front part of the foot, it's not. And that feels really good to babies. Toes also, just squeeze each one of the toes gently. Yeah. Here you go. I'm going to wash my hands, and I'm going to just walk around a little bit here, okay?
Thank you for watching this video. Dr. Tahir is accepting new patients. If you want your child to be seen by Dr. Tahir, please call our office at 262-564-0611 to make an appointment. Go like Dr. Tahir's Facebook page to get his updates on important child topics, fun videos, and any upcoming events for parents and kids. Simply search Family Pediatrics on Facebook to find his page.